Hello, everyone. This is Neville Calleja from Malta. I'm a public health physician. I'm working with the Ministry for Health. I'm actually Director for Health Information and Research here in Malta. And I've also had the pleasure of working with WHO also in the conception, so to say, of the infodemiology subject earlier on in the year. So for me, it's a pleasure and an honor to be asked to share our experience with you, as humble as it may be. So um, Malta, most of you probably don't know where Malta is. Um, just in case you were wondering, let's get the slides working. Yes. So that's Europe, North Africa, Middle East, and that little tiny speck south of Sicily is actually my country. So it's a pretty small country, as you can see. From tip to tip, it measures 35 kilometers. In those 35 kilometers, we have 500,000 people, over 500,000 people actually now. So it's fairly dense. I got some slides from Hootsuite also to describe our population a bit to you, at least for those who are not familiar with our country. The population is actually a bit underestimated there. It's, as I said, it's around 514,000 now. It's been rapidly growing thanks to the economic growth that we have been having the last few years. Well, at least up till when COVID came along. We'll have to see after COVID what happens. Fairly well connected too. And as you can see, internet penetrance is quite high. Including the elderly, I must admit. The elderly seem to be twice as connected as their counterparts in Europe. This is just to get an idea of the demographics. Literacy rate is quite high. Population density, as I said, is fairly high too. It's actually the fourth densest country in the world after Monaco, Singapore, and Bahrain. Um, most people live in an urban environment. Um, Otherwise, I guess nothing particularly remarkable more than any other Western country. In terms of social media penetrance, this is quite interesting. Here in Malta, definitely Facebook is the most popular social medium, followed, even though there's a big gap, by Instagram, which does attract even a different demographic, a much younger demographic. Then Twitter is more of a sort of academic network here. It attracts, or sort of professional level network. It it attracts even less than Instagram, as you can see, and LinkedIn also attracts quite a few people. So Facebook is clearly the medium of choice, also, and for infodemic management in our case, we definitely focus more on Facebook than any other social platform. And as you can see, many people are quite active on Facebook. So just to get an idea, so we do seem to have a very high social media usage, around 90%. Young adults are very active on social media, around about 94%, 89% of whom typically use Facebook on a daily basis. Even the elderly, as I was saying, around 71% of the elderly are actually active on social networks. And this has its pros and cons, I'll discuss later on. This is actually twice as much as the rest of Europe. What then is possibly a bit negative is that it seems that in terms of reading of online news and websites, makes our population particularly to misinformation spread on social media platforms. And as I said earlier, given the high usage, weak at discerning between the right information and the wrong information. Okay, if it's coming off the internet, it's regarded with certain respect, regardless of the source. So it presents some dangers. Um, The local social media landscape, so to say, we are lucky when it comes to infodemic management. Why? Because there seem to be a few highly popular social media groups. So engaging in these groups, you can get a very good grasp of the trends and the currents happening among social media users in Malta. And in fact, these are two of the more popular groups with the Maltese. Salot, by the way, is the Maltese word for a sitting room. So that's why it's called Salot or Disalot. On the other hand, we also have a very active private group amongst doctors, medical doctors. You might think, it's not a big group, 1.3 thousand, but it actually covers most of the doctors in Malta. So it's excellent for inoculation, which we'll talk about at a later stage. Inoculation of the right information, that is. Now, just to give you an idea of our experience of COVID, started off on the 6th of March, like most of the countries for that matter. Grew slowly. We had a peak of, around about, I can't remember exactly, but I think it was like 30 something cases at one point. And that at that point, we basically started implementing measures like most of the countries. We never went in full lockdown here in Malta, but we did have plenty of restrictions. Then in May, we started our transitioning. So first, certain businesses were opened, then other businesses were opened. Then come June, the let's say the transitioning strategy was somewhat accelerated. Um, Government decided, I don't want to go into the merits of that, but government decided not to sort of take it slowly. Unfortunately, what we've seen then with the reintroduction, so as you can see, the numbers were pretty small, zero most of the days during most of July. Towards the third week of July, we started having a rise, which was quite rapid. We believe that the cocktail of foreign imported cases, most of them young people, and some mass events that were happening on the island might have provoked this sharp rise. And there you have it, by mid-August, we were above 50 cases. That said, later on, we saw even higher peaks now as October started, exceeding the 100 cases a day. And unfortunately, today, actually, we had 220 cases diagnosed. So it's definitely on the rise. That said, we reintroduced some measures now. The first most important measure was that of universal mask use. So it is now mandatory by law to use masks whenever you're outside your household or at most not within your private car. I'd like to tell you another story, actually, that we've experienced in Malta. So, effectively, back in March, there was pretty much lack of engagement on COVID or coronavirus, as it was known at the time. So, and we saw this group being born online, and we thought, okay, that's nice. Somebody actually is sharing. So they were sharing legitimate information on this group. The owners of this group were sharing legitimate information. And this group mushroomed. It grew to something like 35,000 members in a matter of days. And we, as public health professionals, started engaging also on that group because we saw an opportunity there to, start spreading the right information. Then we realized that the tone was being, pushed up by the admins of this group, and they were clearly trying to push and instill a lot of fear. I thought, like, this seems to be disproportionate. And then the penny dropped. They started marketing face masks. So in effect, this group was actually created to instill fear in the population and then start selling face masks at the exorbitant price of 160 euros for something like 10 masks or something like that. So it was simply obscene. I've obliterated the name and the face of the guy. I don't want to give him any press at all because I think he was despicable, if you ask me. But just, I'm not sure if any of you had this experience. We definitely thought it was quite something to report on, and I wanted to share this with you so that you're aware and to be careful who you endorse, right? In fact, what happened next is that the Malta Association of Public Health Medicine created its own COVID-19 information group, information page, which, as you might see there, it has garnered now almost 21,000 members, which is pretty decent by the standards of other groups online. If you noticed, by the way, that group I talked about, most people then left pretty rapidly, actually, over a few weeks, and now it's down to 10,000 or so. So basically, what are we facing here? I strongly believe that social media has created sort of an amplification phenomenon. All right. So before, when you had people saying, let's say, I don't want to call it stupid facts, but clearly things that are not credible. Most of the time, they would have restricted themselves, right? Because they knew that they would be not well received. Let's say that, not well received. On the other hand, now with social media, what we've seen is that there is amplification of this message to a very wide audience. And this obviously makes it easier for that person who did not dare say certain things before in public. Now they are actually finding a following. All right. They're actually finding people who applaud what they're saying. And this obviously has created the phenomenon we're facing today of misinformation or fake news gaining so much popularity. Is it a new phenomenon? Definitely not. These publications are publications that were published in 2017, 2018. So it's definitely not a COVID phenomenon, but it has mushroomed since COVID has started. This is complicated, of course, by other factors, such as, for example, even though it has its advantages, the availability of research papers pre-peer review. Is that a bad thing? Well, not exactly. It allows us to sort of keep abreast of research as it's being produced, so to say. On the other hand, we've seen also some people abusing the system and publishing some studies that were later withdrawn. So have to be also very careful in how to use these preprints. We are also faced with a situation where you have evidence that is changing, right? I mean, it's a new infection, you expect evidence to change. But this complicates the business of infodemic management. So we have here the CDC, for example, back in April saying, listen, we really don't have any reason why to wear masks outside healthcare settings. And then that has evolved into more of a pro-mask position. And just, a few weeks ago, we had IHME publishing this landmark paper, which actually quantifies how many lives could be saved if everybody had to use masks outside their household. They claim that up to 40% actually less spread could happen once that is in place in 95% of the population. What hurts even more is when you have medical professionals behind certain misinformation messages. So I think all of you have heard about the Great Barrington Declaration, and basically what's so big about the Great Barrington Declaration is because there are medics behind it, right? We know also that there are a number of American, particularly anti-vax organizations behind this declaration. So for you to be aware, if you've been following the World Congress on Public Health last month, there was quite some talk about this. But people get confused out there. They're seeing professionals saying, opposite things in public. So which one to believe? Again, more medical sources. We have an American group here and a German group, which are both very active. I would say the German group is actually in a stronger position right now. Both of them, again, spreading, the sort of the dictum that have to proceed with herd immunity, blah, 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 protect the elderly. Not that we should not protect the elderly, of course, but it is also a fact that many countries have not managed to prevent that the infection affects the elderly. Now we're facing a situation where the infodemic is rising here in Malta, especially now that we've introduced the mandatory use of masks everywhere. So this was a group actually that was born a few days ago. It was eventually banned, but within 3 days it had garnered 2.6K members. It appears that most of these members are actually foreign residents here who have been obviously influenced by protests, etc., back in their home countries. What they've tried to do is to set up the same group in Maltese, as you see the name underneath. But as you notice as well, the fact that it was in Maltese, the membership has shrunken considerably. So that was clear evidence that there were a lot of foreign residents behind the original group. Um, Finally, what I'd like to share with you is the fact that misinformation penetrates up to all levels of society. Okay. And in fact, this is a collection of parliamentary questions that I got over the weekend from a particular MP in the Maltese Parliament. And if you have a look at them, you will realize that these questions sound familiar. Okay. I'm sure those of you who have been following misinformation as it's spreading through social media, you will recognize these questions as having been driven by this misinformation flow. Okay, so the issue of autopsies, the issue of ventilators killing people, um, that the flu vaccination is killing people, and again, the Great Barrington Declaration. So this is the situation we're facing right now. Misinformation, the infodemic is definitely increasing, possibly even more rapidly than the infection itself. So there's definitely the need for more infodemic managers out there to manage this growth. Okay, so, and I leave you with this. This is my haiku contribution to the infodemic training. Um, I think these are key principles when trying to do your job as an infodemic manager. You definitely always have to maintain your professionality, never raise your voice, never insult anyone, just explain patiently using evidence why what is being said is illogical. And ultimately, when you do that, you will achieve inoculation. Inoculation of the right information into the social media groups. I've seen it happen myself, and I think it will happen to you too. People will start following you and replicating your messages if you manage to deliver them clearly in the right language and logically. So good luck with your new task.